All right. Good afternoon, everyone. Welcome to today's COVID-19 update for Yakima County. My name is Jocelyn Castillo, Community Health Specialist at the Yakima Health District. Joining me today is Dr. Teresa Everson, Health Officer at the Yakima Health District, and Kevin Chase, Superintendent at the Educational District Office 105. If you have questions about today's update or questions that you would like us to answer during our next update, please leave them in the comments section of this post. And to begin, I'll be sharing some information on our current numbers. As of yesterday, we were at a total of 13,844 cases of COVID-19. There are 15 individuals who are currently hospitalized due to COVID-19. 2 individuals are intubated. And unfortunately, since our last update on November 5th, we have lost an additional 6 community members, totaling the total number of lives lost to COVID-19 to 254. And as some of you may have seen from our social media yesterday, we have seen an increase in the number of new COVID-19 cases over the past few weeks. And due to this increase in cases that has been happening not only in our county, but also statewide, the governor has released a new set of safety measures, new temporary safety measures that will remain in effect until December 14th. And I'm just going to share my screen here real quick to go over some of those. All right. And so first, no, let me get out of here. All right. So first, in terms of indoor social gatherings, they are not allowed unless you quarantine for 14 days prior to the gathering, or if you quarantine 7 days before and receive a negative COVID-19 test 48 hours before the gathering. For restaurants and bars, they have been closed for indoor services. However, outdoor dining and to-go services are still permitted. And then for fitness facilities and gyms, which includes museums, bowling alleys, and movie theaters, they have also been closed for indoor operations. And for religious services, they have also been limited now to the 25% occupancy or no more than 200 people, whichever is less. And these are just some of the few measures that are in place now. To view a complete list of the new guidelines, you can go to our website, our Safe Start webpage, and download that list here. And so right now it is extremely important that everyone in our community follows these new guidelines and continues to practice the recommended preventative measures such as wearing masks and practicing physical distancing of 6 feet in public places, avoiding close contact with or avoiding gatherings with people outside the household, staying home if you're sick, and getting tested if you have COVID-19 symptoms or have been exposed to COVID-19. For any person who is seeking COVID-19 testing, you can find a list of different testing options here on our testing site webpage. This is where we update the schedule for our community-based testing sites, and we also have a list of other available testing locations in Yakima County here. And so we also understand that the new safety measures may cause a lot of stress and anxiety for some of our community members. And so we want to remind everyone to take time to care for themselves, take time to do activities that will help clear your mind, take time to connect and check in with your loved ones, and seek additional support if needed. The Washington Resource Line 211 is a great resource for any person who's seeking local health or social and financial resources. And finally, with Thanksgiving coming up next week, we also want to encourage everyone to consider safe Thanksgiving celebrations. The safest option is to celebrate at home, only with the people you live with. And we know that this may be hard. It may be a hard conversation to have with family members, But right now, this is the best thing we can do to prevent further spread of COVID-19 in our community. And even though we may be physically apart from our friends and families, there are still ways we can connect virtually. You guys can share recipes, cook together, or give thanks, or have dinner online, via Zoom or even FaceTime. We want everyone to stay safe and healthy this Thanksgiving holiday. And so now we're going to hear from Dr. Everson and Kevin, who will be answering some of the questions we have received from the community. I'll start off with questions for Dr. Everson. All right, so the first question is, does the new CDC definition for close contact mean that you will make a new recommendation to schools?
So thank you. Thank you, Jocelyn, and thank you everybody for submitting your questions. Keep them coming. You all ask really great questions that a lot of other people are wanting the answers to. So for this first one about whether or not we're going to change our practices or our recommendations for school with this CDC definition change, it really won't change our approach to how we identify close contacts for cases in schools. We have always taken into consideration things like duration of contact. So we know that students are often in school together for 5, 6, 7 hours. So that's one of the factors we take into consideration. And we have, throughout this response, partnered really closely with our school nurses and with our other school COVID response partners to help identify any individual that a case may have spent a significant amount of time with. And that new definition is within 6 feet for a total of 15 minutes throughout a 24-hour period. So we've always been asking those questions about, well, where does the student or where does the staff member tend to spend their time? Who do they spend most of their time with? So it really shouldn't change our approach to working with schools.
All right. Thank you, Dr. Everson. Second question is, why is it safer for retail stores to open and schools and not fitness facilities or restaurants?
Yeah, thank you for that. I want to echo what you said about how hard all of these new rollbacks are, especially when we had so many months of success in controlling our spread. So we're really feeling how difficult this is for everybody. And I just want to take us back to some of the fundamentals of transmission for COVID-19. So we've seen over the past 8 or 9 months across the world that transmission is highest in areas where there's prolonged contact indoors. It's worse when there are masks off. So when you think about activities that are approved right now where people are indoors together with masks off, restaurants kind of rises to the top of that list. Most of the other things we're doing right now have masks on. So that is why indoor dining has been rolled back with some of these newest measures. And when you compare an hour inside with a mask off at a restaurant to maybe a 30-minute shopping trip with your mask on in a really large space in a store, there's just higher risk in an indoor dining environment. And then about the fitness facilities, for fitness facilities, usually you're there for longer than 15 minutes. And the kind of activities we do in fitness facilities usually involve either harder or faster breathing or both. So there's a little bit higher transmission risk there. And then really what this all comes down to is those who are making policies for public health having the very difficult decisions around which businesses and activities are critical function and must stay open, and what activities can be paused. And really we're faced with pausing as many activities as possible. So figuring out the appropriate line there is a really tough choice. So that's where some of these recommendations are coming from.
Another question we received is testing for COVID-19 safe for children?
Love that you asked that question. And we have a lot of parents who are concerned about taking their kids for testing, which tells me they probably haven't gone through a test before to understand what the process is. What we talk about when we talk about testing at the district is that the cotton swab test that we do is safer than the nail on the finger that your kid probably puts on their nose from time to time, because it's a cotton swab. It's less traumatic than a finger in the nose. And really it is just that. Most of the testing that we're doing in the community, certainly at our community-based test sites, but most of the clinics in our area are using a simple swab in the very front of the nose, just in the nostril here. And I will clean my hands after I'm touching my face, but it's just in the front. It's not that nasopharyngeal swab that goes way back in your head. That's what I've had done 5 times because I live in a different place. And the question is whether or not they're safe. They're all safe. Some are just more comfortable than others. So the testing that we're doing in Yakima County right now is pretty comfortable. It's just the front of the nose, the nostril swab. So please get tests when you need them.
Thank you. And then why is it important for people to get vaccinated generally and for COVID-19 specifically?
Yeah, I love this question as well. So for every vaccine preventable illness, these are things like measles, chickenpox, whooping cough, influenza, there is a certain percent, a known percent of the community that needs to be immunized to achieve what we call herd immunity, which is essentially when enough of us are immune to an infection that it can't spread very effectively, and any outbreak there may be dies quickly because it has nowhere to go. And immunity only comes from infection or vaccination, unless you're a newborn and you have a little bit of immunity for some things from your mom. But unfortunately, this infection comes with a pretty high risk of hospitalization and death compared to other illnesses that we vaccinate for. So really, vaccination is the safest way for us to achieve that herd immunity in our communities. Just thinking about this vaccine, if you've all been following the news like I have, we know there's a couple of good candidates in the pipeline right now. We don't really have a firm timeline as far as when those might actually be ready to distribute in our community. But we do know that it takes a couple of months for them to finalize those trials, for the vaccination to get approved, for them to produce it on any kind of a mass level, to distribute it, for us to have all of the things in place to be able to administer it locally. So I think we are a couple of months away, even if one of these two kind of front runner candidates ends up being the right vaccine, the safe, effective vaccine. So I just want you to know that there has been planning from the federal level to the state level to the local level for the past couple of months on what this vaccine distribution might look like. And honestly, this kind of preparation is something that we do even when there's not a pandemic at the health district. So we've been planning for this kind of activity for a long time, and we're certainly doing increased coordinating with our community partners around how we might be able to distribute that as quickly as possible when it's time.
Thank you, Doctor. And then the last question for you is, do I need a quarantine if I come into close contact to a person who was around someone with COVID-19?
Yeah, like do I have to quarantine if I'm a contact of a contact?
Yeah.
Is the question. And the short answer is no. We don't recommend quarantine unless you are in direct contact with someone with COVID-19. There are very few exceptions, and I don't want to make this too complicated, but there's a little bit definition for somebody who is a confirmed case, which means you had a positive test. And then there's somebody we call a probable case, which is someone who is exposed to somebody with COVID-19, and I don't have COVID-19. I got my test result today. If you're exposed to somebody with COVID-19 and you have symptoms, but you either don't have a test yet or we're not sure about the test results, so there's a probable case and there's a confirmed case. Really, the short of it is you don't have to quarantine if you're a contact of a contact. You should only really be quarantining if you're a contact of a case.
Okay, thank you.
With that, I want to add one more thing though. This question kind of implies that the contact never got a test, and it's really important if you're a close contact of somebody with COVID-19 to please go out and get your test so we know if you've got it or not. And then really everybody who is a contact of a case should be quarantining, so you shouldn't be in contact.
All right, thank you. And now we're going to move on to Kevin. So first question for you is, how have schools adapted to going back in person, and for those that are still online?
Well, before we go too much farther, I want to thank Dr. Everson. The educational community in Yakima County has relied upon her heavily for guidance and help, and I know that she is ending her term with us, but I want to thank you specifically from all of us for all the support and help you've given us over the time. And we understand personal reasons are personal reasons, and you've got to move on, but I got to let you know we appreciate you, all of us.
You're so welcome, Kevin. It's been my honor.
It's been great. So let's start with schools and adapting to going back in person. And a lot of that really relies upon the Yakima Health Department's guidance. They've really helped us lay out what are safe and what are prudent measures to take for kids coming back to school. So we've done a really pretty good job, I think. We have an attestation process in place. So every single student and every single staff member that's coming in every single day attest to the fact they have no symptoms. If any of the symptoms are checked, they're asked to stay home, and then they either they get tested, or they figure out whether or not those symptoms are COVID related. So every day we screen everybody. And then the next step is, of course, we have a rule, the 6-foot rule, which means every student in the classroom has to have at least 36 square feet of space. So we're coming back in much smaller numbers in a much more spaced way. So the picture of kids rolling into a classroom of 35 kids with the teacher and all the desks and rows or pods, that's not what's happening. So we've taken a lot of precautions to make sure that the in-person learning is one that is, number one, follows all the guidelines, masks, social distancing, cleaning the equipment, cleaning the materials. And we've been very successful, right? There's been a number of schools that have come back full-time, full of kids that have had 0 infections. And specifically, I think there's a less than a handful of infections that have been related directly to coming to school. Any infections that people have been turning up with inside the school system normally are coming from somewhere outside of the school system setting. So people can feel assured that this in-person schooling is working well. I think people are very excited about it. And then those that are still online, obviously they're doing remote learning, and that has been something we've been doing since last year. We've been getting better and better at it. Are we great? No, but we're getting better. We would certainly prefer to have kids in school that we could see every single day, but I would also much rather prefer that families and students in our community stay healthy, right? Getting COVID can be a real problem for students and staff, and we don't want to take that chance, right? We'll get through this. We'll get through this, and then we'll be able to bring people back, and we'll catch up. Don't worry, we'll be there.
Thank you. The second question is, what is the goal of the superintendents for families now that COVID-19 cases are increasing?
Well, I do want the community to know that, number one, we want them back. We want your kids, we want our staff, we want our teachers, we want our parapros, we want our bus driver, our food service, and everybody else that works in the school system. We want you back in school. We want you back in a place that you feel comfortable and safe. So the real goal for us is, it's a balancing act. The first priority is keeping people safe from infection. We do not want to increase the infection rate in Yakima County. That's the real goal. The second goal is, if we can do that properly, can we bring back certain students who need the most support? We call it the furthest away from educational justice. So there are a number of students who really need support, whether they're special ed students or EL students or students that are that have social emotional issues. There's a lot of kids in real need. So we will bring them back as it is safe. And then the next layer would be bringing more kids back, but in a much smaller numbers, so that all kids get a taste of coming back, but in a very sporadic way, whether that's Monday, Tuesday, Thursday, Friday, A, B, everybody's going through it already. But the real goal right now is to stop the increase of infection. And Dr. Everson is right. I mean, we're tired, right? Everybody's tired of this, but we have got to have persistence and grit. We teach our students mindset around persistence and grit. And if you have those two things, you can outlast. So we've just got to bear down as a community and as a county and pick up ourselves and just bear down and say, hey, we can make this happen. And if we follow the directions, this will be a much shorter journey than it will be if we do not follow the social distancing, the masking, and all of the things that are happening. Bear down, make it much shorter, take the pain now instead of doing it over a period of time.
Thank you. And then can families who do not want their kids to go to do school in person remain in online only?
Absolutely. So here's the way that works. Most school districts, if not all in the Yakima County, have an option for all online learning. So they can just contact their school district, and most of them have. And to be honest with you, about a third of the families in Yakima County told the districts, we're interested in staying home. We don't want to come back. We don't feel safe. We're going to stay home and do remote learning. So most districts have that option for every student in their district. The second option, if yours is one of the very few that may not have that option, there's always another option. You can look online, like, WashingtonInsight.com. There's plenty of online schools that you can withdraw from your district and enroll in their program. So certainly, if they want to stay home, stay online, they can do that. Plenty of options for that.
All right, thank you. And then just the last question, where can families seek help if their kids are struggling?
Well, I know that's difficult, but it's not, the answer is the same every year. Start with the teacher and don't be afraid to talk to them. You know, email them, call them, Zoom with them, and say to them, you know, I'm really concerned. Jocelyn is struggling. She doesn't understand math. She's really lost in the Zoom atmosphere. I really need some extra support. And don't be afraid to start with a teacher. And then if you don't get what you want, then you'd move up the chain, right? You go right to the principal. Say, hey, I need some support here. My kids can't get access to the internet. I can't get them to get online. You know, there's lots of things that are happening. And then if you don't get satisfaction with the principal, move up to the district office. But that's always the chain of command. Start with the teacher first, go to the principal, then go to central office. But do not be afraid. Reach out, tell them now. Don't say, oh, I don't want to be the one, the squeaky wheel. Be the squeaky wheel. They're the ones that get the grease. I guarantee you, I would, you know, as a parent, I would do the same thing, even though I was a superintendent. It wasn't that good. But the answer is don't be afraid. You'll get the grease, and that's important. Do it.
All right, well, thank you so much, Dr. Everson and Kevin, for joining us today and helping us answer some of those questions. That is all the information we have for today. Thank you for watching.
Thank you, everybody. Thank you, Dr. Everson.
Thank you.